So today we're talking about peripheral neuropathy. This is a side effect from chemotherapy that affects roughly 30 to 70% of people going through chemotherapy. It might present as a numbness, tingling, or even pain in your hands and your feet. You might notice yourself dropping keys or fumbling with buttons, or maybe as you're walking, you notice your feet keep catching or you feel like you're going to trip. So there are some strategies that you can take while you're getting your next infusion that can help minimize any impacts from chemotherapy. We're going to go through those in a moment. First, I just want to introduce myself. Hi, my name's Naomi. I am a certified occupational therapy assistant and a 2-time cancer survivor. So I'm bringing forward these 2 strategies because 1, I want you to see the research that is out there. And 2, I want you to be able to talk to your oncology team about this. They know what medications you're taking, the dosage, and you can see what might work best for you. So there's 2 main strategies for trying to protect our hands and feet during the infusion. One is called cooling gloves and socks. So you're going to be wearing very cold gloves and socks on your feet and hands the entire length of your infusion. In fact, you start 30 minutes prior, then the whole infusion, and even 30 minutes on the end. These work by constricting your blood vessels. So the cold temperature is going to make your blood vessels get really small, and that is going to prevent the chemotherapy from attacking your hands and your feet. Now, I want to point out a few very important caveats to doing this. 1, if you are taking a chemotherapy called oxaliplatin, this is contraindicated. You cannot do cooling gloves and socks. There are other strategies, but this would not be for you. If you have Raynaud disease, where you have high sensitivity to cold in your hands and your feet, this also probably is not a good strategy for you. And if you've already had peripheral neuropathy and you already have diminished sensations in your hand and your feet, really talk to your doctor about this because you may not be able to have the sensory cues as to when it's time to take them off and if they're working properly. Now, research has shown that these gloves have worked really well. The issue is the tolerance. It's very hard to wear something this cold on your hands and your feet for hours. I also think there's some strategic issues. Like, how are you going to make sure they stay cold? Are you going to buy 2 pairs? And then where does the pair get frozen or kept at the facility? Is that even an option? Also, how are you going to manipulate things with your hands if you're wearing gloves? They're really like large kitchen oven mitts. It's going to be hard to manipulate your environment if you're wearing big oven mitts on your hands. So these are some things to think about. Definitely talk to your oncology team about cooling gloves and socks. See if they've seen success with them. See if they have any suggestions for how you can manage it. And then the other strategy is compression gloves and socks. So these work in a totally different way, but it has a similar outcome. So instead of the cold constricting those blood vessels, you're going to have compression. So this tight fabric is going to really limit the size of your blood vessels and thereby limit the amount of chemotherapy impacting your hands and feet. This has a few pros with it. 1, you're not going to be freezing cold. So that's great. You're also going to have access to your fingers and your digits. You can do things and manipulate things in your environment because your hands aren't in a big mitt, but instead in a regular glove. Also, it has been shown to be more tolerated by individuals. In the different research that was done comparing the cooling gloves to the compression, they found that the compression gloves had higher adherence because people were more comfortable. And I also want to bring up, there's a few really interesting studies being done right now here in the beginning of 2026, where they're looking at wearing surgical gloves on your hands. So instead of buying compression gloves, you could use surgical gloves. They need to be very tightly fitted, and you have to put 2 on both hands. But there's some research showing that that is also very effective. And one reason I really like this is because maybe, And I have no idea, but maybe at your oncology office, they have surgical gloves. I don't know if they do or not, but it is something you can inquire about. You can show them the study and say, hey, is this something that could work for me? Well, I hope this has been helpful. Good luck on your next infusion, and I will see you next time. Take care. Bye-bye.